So, Wolf in 2013 highlighted patterns of knowing in nursing as a tool to produce a clear learning and thinking on patient experiences. So, four ways of knowing nursing tool highlights four ways of knowing. Number one, empirical knowledge. Two, personal knowledge. Three, ethics of knowing. And four, aesthetic knowing. So, for example, um, uh, discussions involving medication and goals of pain control were consistent with empirical knowledge necessary to prescribe and administer needed medications. So the empirical knowledge is of pharmacology coupled with the aesthetic knowing and personal knowledge of end of life situations, which is necessary to educate the family about the patient and family about the goals of treatment. So, with the relationship with the patient and family and allowing discussions, that's in regards to the ethics of knowing. So, that all ties in as far as um, four ways of knowing that the tool that nurses can use as far as when they interact and try to build that relationship with the patient.
My name is Adriana Gonzalez, and I have research evidence. Um, Lamb et al. State that emotional distress refers to the psychological, emotional, mental, or spiritual anguish that the patients experience. Lamb et al. Add that although emotional stress refers to psychological suffering, some authors believe it is a prominent clinical factor which may in turn reinforce or even cause physical pain. If psychological suffering brings about somatic symptoms, then would palliative sedation help prevent these? There may not be a consensus as to whether palliative sedation should be used in cases of existential stress. However, a study by the Journal of Palliative Medicine indicates that continuous palliative sedation is also used to address situations in which physical symptoms and non-physical symptoms accumulate into a refractory state in which a patient suffers unbearably. Additionally, the study states, this study is by Swart et al., 2014. Additionally, the study states that some respondents of the study considered life expectancy to be less important because of the urgency of relieving severe unbearable suffering. Stewart et al., 2014. In the case that the patient, family, and/or provider does not feel comfortable with continuous palliative sedation, there is also the option of intermittent palliative sedation, although it is not as commonly used. According to Song et al., with intermittent palliative sedation, patients are sedated temporarily and then awakened after a predetermined time to assess whether refractory symptoms have improved. The article, Long-Term Intermittent Palliative Sedation for Refractory Symptoms at the End of Life in Two Cancer Patients, follows two patients through intermittent palliative sedation. The indication for palliative sedation in our cases, states Songs et al., were simultaneous, intractable pain and other symptoms such as insomnia and delirium. Song goes on to explain that those symptoms were controlled to tolerable stages by intermittent palliative sedation during the final weeks of their lives. The findings of these cases indicate that patients in the dying stage who have refractory symptoms and want to preserve their awareness might be appropriate candidates for intermittent palliative sedation. This is according to Song et al. 2015.
Okay, my name is Claudia, and I'm going to be discussing the role of nurses in palliative sedation. So nurses can help patients by utilizing an approach that includes the options accepted by the patient and the patient's family based on the options provided by the healthcare provider. Lewis highlights the importance of utilizing a proactive approach when discussing palliative sedation care in order to provide the patient with efficient care and maximize the patient's quality of life. Thomas, Tanner, and Wilson also highlight the importance of advanced care planning. They also highlight how nurses can help with advanced care planning by receiving training regarding end-of-life care. According to Lewis, nurses have multiple functions, such as providing basic care needs, which vary from patient to patient, such as repositioning patients to maintain skin integrity, providing medications to help minimize the multiple symptoms that can occur during the last phases of life, such as pain and nausea. And it also includes hygienic interventions to provide the patient with the care as he or she becomes debilitated and unable to perform self-care. Continuous palliative sedation can be used with other options or when other options have failed to provide the expected benefits and when patients are expected to expire within 2 weeks. That is according to Clark et al. Continuous palliative sedation can help patients that are having multiple symptoms, for example, patients with metastatic cancer, severe pain, and with no other treatment options. Continuous palliative sedation can also help to treat patients with difficulty breathing. Some of the goals of continuous palliative sedation are to maximize the patient's quality of life and to preserve patient dignity. Bharati and Chandra specify how palliative sedation helps to minimize a variety of symptoms experienced among patients with illness. They also mention that sedation does not cause patients to expire at a faster rate. Thomas et al. And Lewis have a common view. Most patients lack palliative care information, and that is when care providers avoid upsetting the family or patients, and so they avoid discussing end-of-life care options. According to Bharati, multiple medications can be provided to improve cancer-related symptoms. Sedatives can be given continuously to minimize severe symptoms, and in less severe cases, treatment can be provided at specified time intervals. Nurses can apply their multi-level efforts combined with updated and refined advanced care planning to help patients transition as efficiently as possible from one stage to the next as they approach their end-of-life phase.
Hi, I'm Bernadine Bustamante again, and continuing on action items, things to think about and highlights to think about are training and guidance tools similar to the UK's LACDC for nurses and healthcare providers for the dying patient should be used toward providing a high-quality end-of-life care experience for patients and their families, even if the care would include palliative sedation based on the wishes of the patient or patient's family. So it's essential that nurses and other care providers of the care team for an end-of-life patient receive education on how to communicate and remain supportive of the decision of palliative sedation to their family members. This would relieve any negative feelings or burden that the family member could be feeling after making such decision. And lastly, the patterns of knowing as a nursing tool is an efficient tool that nurses should use towards added support and education on the use of palliative sedation for a patient and their family towards a positive end-of-life care experience.
And here is a list of our references. Thank you for allowing us to present our topics to you.